Hello, everyone. It's indeed a pleasure for me to share some insights and perspectives on the hybrid approach in pharma marketing from the Indian pharma market. And at the outset, let me thank Sylvia and CredoWeb for this opportunity to share my perspectives and thoughts. So, I think this is a very interesting question that all of us would have found answers from various market research agencies over a period of last 12 months. And we in India also did very detailed and in-depth market survey among the Indian pharma professionals coming from a very wide therapeutic segments, their experiences from anywhere from 10 years to 35 years, and a variety of roles in the companies that they work with, so that the uh, insights that we got from them is from a very diverse background, as you can see even from their profiles of their companies. And India is a market which has got very huge reliance on mega field forces. So more than almost 50% of the companies had more than 1,000 medical reps. It might surprise you in Europe to know that there are pharmaceutical companies in India with more than 5,000 medical reps, and some of them, at least the top five, having field force as much as 10 to 12,000 people who go out and meet doctors on a daily basis. So for them, the impact was very huge. And suddenly to have such mega field forces sitting at home and not even being able to work from home meant it was one of the huge or the largest impact because of the COVID-19 crisis was on the field forces. And therefore, the impact was on the revenues. As you can see that the smaller companies with less than 100 medical reps had the biggest impact, and that is because that is the only channel they would have had to engage the doctors. And when that channel was shut down, because India was one of the first countries to go into lockdown in March itself, the impact on their revenues was huge. Indian companies, that's the domestic pharma who are mostly into generics, saw a greater impact on their revenues as compared to MNCs. And this brings us to an important insight that building brands is very important. And those companies, whether they were MNCs, largely MNCs are focused on building brands, but there were several Indian companies also uh, that built very good brands, and these did not experience such a large impact on their revenues as compared to those companies who had focused only on volume sales based on transactional model. Lack of customer engagement and supply chain issues are the biggest reasons for revenue impact, and doctors and hospitals had to shut down, and even patients were not able to see their doctors, and all these had an impact on the revenue of pharmaceutical companies in a very big way. And this impact continues even after almost a year to even February last month. Impact on the revenues continue. And that's primarily because there has been a huge impact on sales calls. So the cardiovascular and diabetic segments saw a major impact on their sales calls. That's because at least 50% of the Indian pharma companies have a division either of cardiology or diabetology or both, as these are the fastest growing segments in the Indian pharma market because of the shift from acute and infectious diseases to the lifestyle diseases segment. Around 50% of the doctors still do not welcome medical reps. It's quite challenging them. Many times they meet them in the parking lots and in the corridors. So the companies have come out with their own video conferencing apps. However, the challenge is to put content that is of value to the doctors, as doctors are rejecting the old content and the repetitive content, brand messaging. And also, there is lesser time available to detail brands, but slowly and steadily, the field forces are getting back to uh, work more and more. Well, what about the hybrid or the mix of face to face? How is it understood by the pharmaceutical businesses? Here's again some more perspectives from our survey. As you can see that most of them still favor the face-to-face calls, because I think it will take some time for them to get away from this. This is where they have their largest investment. But it is encouraging to see that remote conferencing and CMEs, remote CMEs, were also found somewhat effective, and small group meetings also were found effective, and many other channels somewhat effective to not effective. So, as you can see, clearly we have not fully grasped what is the hybrid model in digital marketing, and we are in a very, very early stages, I would say the evolutionary stage, in understanding hybrid model of marketing in the Indian pharmaceutical industry. So the next question is, what are the medium term expectations of the business? Will we return back to normal? Very interesting question. So I looked up some international reports as well. These were some from EU5. Is it a blip or a shift? So only 7% expects no change in rep calls going forward. So I'm sure that this would be the case with most markets, whereas in India, I don't think this holds good. Almost 50% of them still think or still hope, because of their preponderance and over dependence on the field force. But this is the status globally, and the same report also shows that there has been an acceleration uh, in technology adoption thanks to the COVID-19 crisis. So again, some perspectives from the Indian market. 50% of the companies have equipped their field forces with iPad and some suitable content or some other gadget. And 50% of the smaller companies still rely on paper-based promotional tools. So these are the ones who will find it challenging, let alone go to the hybrid model, even adapt any kind of digital tools. Whereas I'm sure that most of the MNCs have adapted digital in some way or the other. The challenge is to integrate that with the field force, uh, the marketing, the medical, all coming together instead of working in silos. So here's a quote from Dr. Sanjay Mitra, who is one of the doyens of Indian pharma in the market research field. So his advice is to use COVID as a trigger to digitalization without dumping all the benefits that has accrued from the field force because of the years of calling and the relationship that has been built in. More importantly, Indian pharma companies also see the challenge uh, that doctors themselves will have uh, quite a bit of challenge in adapting digital. So these are some of the challenges faced by in engaging doctors: lack of right content. So now you have to give content that is personalized and of definite use to the doctor instead of the earlier brand-centered promotions. The Salesforce capabilities. The Salesforce are used to a sales approach, which will have to change to become doctor centric and patient centric. And the lack of digital infrastructure is also a concern, and the marketing team's digital capabilities. So, marketing will have to rethink a lot of things, and resource constraints. These are some of the challenges uh, that will probably keep many Indian pharma companies where they are. But it was also encouraging to see these changes that uh, 85% responded that they would be using digital to improve their engagement with doctor, and that would be their key uh, focus, and improving the commercial team engagement so that all of them work together and everybody is there to support the field force when they connect with the doctors either face to face and then supplement it and augment it uh, with digital efforts, and then generating insights so that companies knows what they're doing, what is the um, impact of each of their digital efforts, so that they can quickly fine tune those offerings and continue to personalize it and make it effective. So I think this is the biggest challenge for many companies, building the commercial teams capabilities. So there will be a lot of scope for upskilling, a lot of room for building the talent, because both from the internal perspective of having a digital uh, talent, as well as from the vendors side, there is a definite shortage of talent, and building the capabilities would be an important area for focusing on. So, thank you very much for this time once again. And I hope you enjoyed, and I look forward to interacting with you all over again.